Hi, and welcome to It's Your Health. I'm Dr. Rick Duplantis. This show is designed to empower you with information and knowledge to make the proper decisions about your health and your welfare. Tonight we're talking about the deadly disease called Ebola. This is a very big health crisis in our country, and the big scare, a lot of myths, a lot of misinformation out there. This is the outbreak in West Africa that has the whole world in a panic-stricken mode. We here in the United States are not an endemic area. We are not at risk for the Ebola virus as such. My guest tonight is Dr. Virasith Rajapho, who will speak on the topic of Ebola. Dr. Virasith is an internal medicine physician, a hospitalist at Our Lady of Lourdes Hospital here in Lafayette, Louisiana. I want to ask you a few questions about Ebola.
Sure.
Common questions that I think the public would like to know about here. This Ebola thing has really been, I think, politically blown out of proportion, more or less, and it's happening in West Africa, in the three countries of Liberia. It's happening in Sierra Leone. It's happening in Guinea, and those are very hard-hit areas, over 4,000 deaths at this point from this virus. And, I want to cover the topic and give the viewing audience some information on this very serious topic in health. This program is designed, like I said, to give people information that they can use to protect their health and improve their life as well. And this is what we're trying to do tonight with this topic of Ebola. First question, of course, is everyone wants to know, what is Ebola? Can you tell me exactly what this is?
Sure. Ebola is a virus. What that means is very small. In and of itself, doesn't do anything. However, once it gets into your tissues and all that, that's when you start doing the damage. But but it's a virus. It's all it is. So.
This Ebola issue is nothing new. We know a lot about it, actually. 1976, we had the first outbreak of Ebola. Under Ebola, there's five different strands of Ebola. The most lethal one is the Zaire form of Ebola, and it's 90% lethal, actually. And the name Ebola comes from the lake in Ubanka. Right. There was a lake, an Ebola lake, and they named the virus after this lake. And there are three different types of Ebola. But like I said, the form that we're dealing with the West African outbreak currently is the Zaire Ebola. And we want to address that. And, signs and symptoms of this disease, that people are having a lot of different symptoms and presentation of it. And how is it spread, and what's the risk? These are all big questions that people really want to know answers to. And let's shed some light on the topic for the viewing audience. Your input, please.
My input is, the most important thing is travel history. Because if patient comes in, never been out Louisiana or out the country, very low risk. The symptoms in of itself, because it's a virus, you get virus symptoms, which is fever, malaise, fatigue, those things, but the thing about Ebola is, you also get diarrhea, abdominal pain, and headaches, but the fever is what gives it away, and timeline is also important. Usually it occurs between 2 and 21 days after you've been infected with it, but travel history is most important. You have to see if has the patient, came from the endemic area, which is the countries you mentioned, the Guinea, Sierra Leone, and Liberia. Those areas, if they've been there, or another thing is have they been exposed to it, But those are the basic things that we use to screen patients for Ebola.
You talk about the vomiting, and you talk about, and of course, diarrhea is another one of the symptoms, and you're losing a great deal of potassium, you're losing a great deal of hydrochloric acid in the stomach, so you're going to end up with a metabolic alkalosis type situation, and you're going to end up with low potassium, hypokalemic state, and also low chloride as well, because of the loss of that in the vomitous fluid, and also in diarrhea, you're losing a great deal there too, electrolytes. So I guess going to the treatment of these people with these conditions, you normally do fluid replacement, don't
Right.
you, for volume to stabilize the volume, because you have a
Right.
great deal of volume loss. You might, I guess, have a lot of delirium with these patients because of drop in sodium as a result of all this fluid loss
Yes,
as
yeah.
well. And then supportive therapy would be to give fluids. You know, that's an obvious thing. And
Yes.
that's palliative, and that's what we do for us, the supportive care that's given in Ebola.
Yes.
Any treatment besides that, besides the support of replacing the electrolytes that are lost, you know, the derangement in electrolytes that occurs in Ebola. What other things can we do for these people?
In terms of treatments, you know, there's no vaccine for it. There's no antiviral medication for it. It's all supportive care, you know, pretty much what you mentioned. You know, if the patient is dehydrated from the diarrhea, the nausea, vomiting, you replenish him. You know, you give him IV fluid resuscitation. You know, but you know, you also have electrolyte disturbances, so you have to do lab work, you know, and plenty of it to see, you know, if they had lost any, and then you replace it as such, you know. So usually, you know, when all of that becomes out of balance, and that's when they start to have complication from it. You know, another thing is, you know, if the patient's having a fever, you know, you treat the fever. You know,
Correct.
so it's all supportive care. You know, so pretty much what supportive care means is
Treat the
whatever
symptoms.
symptoms they have, you treat it. You know?
To treat them, yes. You know, they call this the hemorrhagic fever,
Yes.
this Ebola. And, you know, this hemorrhagic, the hemorrhage aspect of it, loss of a great deal of blood, the bleeding from all of the IV puncture wounds and stuff, kind of resembles a disseminated intravascular coagulation that
Yes.
occurs.
Yes.
You know, and from the information I have found regarding Ebola, that there's a breakdown in the wall of the vascular system, the lining called the endothelium, and this is destroyed by
Yes.
the glycoprotein of this Ebola virus organism, and that is where your hemorrhaging takes place.
Yes.
But we have liver failure
Yes. Mm-hmm.
and we have kidney failure from this condition,
Mm-hmm.
and of course, I can understand the kidney failure, but from the standpoint of loss of volume, I'm sure there's a hypotensive state that occurs, low blood pressure,
Yes.
and there's not enough blood pressure to perfuse the kidneys, and then the kidneys fail as a result.
Yes.
And we're doing the fluid replacement to augment that condition and improve it, and to bring these people back. But this hemorrhagic aspect of it, I think more the palliative care, when they start the bleeding from the IV sites and manifest this coagulopathy type situation, this disseminated intravascular coagulopathy, that, you know, then you could do another supportive care, maybe give these patients heparin, in that case, as a physician, and these people are probably giving the clotting factors, because when the liver goes down, the liver produces all of the factor K clotting factors 2, 7, 9, and 10, and these all support proper and normal blood coagulation, and we lose these when the liver goes down. The liver fails as well with the kidney, so we replace, I would think, those coagulation factors, maybe heparin, IV fluids, plasma that contains all the clotting factors, and I guess packed red cells because they're losing this blood volume. You want to bring these people back up to homeostasis, to feeling better. They're going to be feeling the fatigue and loss of energy, and just going to be just dehydrated from the loss of fluid too. Let's talk about how is it spread. How easily it is to get Ebola. How do you get this?
You get it by becoming in contact with bodily fluids from the patient that are infected with Ebola. Usually, you know, healthcare workers are at risk because they come into contact with saliva, blood, you know, sweats, and, you know, it can get in, you know, not just through a needle puncture, but it can also get in through the eyes, mucous membranes of your mouth. It's spread that way, you know, so it's mainly by what we call in the medical community direct contact, you know,
Right.
or through, and basically through droplets, you know, from the direct contact of the droplets.
An open cut,
Yes.
the mucous membranes possibly as well.
Yes.
What group of people who are more susceptible to contract this?
The one that are more susceptible to contract this are definitely the one that are immunocompromised, and mainly because, you know, it has a lot to do with your immune system too, because your immune system, you know, fights it off in the early stages.
Right.
But the one that are immunocompromised, they become susceptible to it a lot more quickly.
I know that in this, there's a lack of host response. You talk about the immune system, which leads, to the point of that there's a lack of host response, lack of the body's ability to fight it, and that's a condition called lymphopenia, the lack of white blood cells to mount and get a reaction. And somehow this virus kind of bypasses these neutrophils, these white blood cells that protect us and give us our defense and to launch a defense against these foreign organisms that come into the body. And so this organism has the ability to kind of skate by those defense mechanisms that we have and produce a host, immunity against this organism. Let me ask you this. Any known cases in Louisiana of Ebola?
Louisiana, no.
Okay.
Fortunately, we haven't had any.
Yeah. And in the Texas case, the people who were infected besides were hospital workers. And let's talk about who really is at risk and people who have the contact with these kind of people, the people treating them, the family members maybe.
Yes, yeah, definitely. You mentioned family members. Of course, family members and, healthcare workers and pretty much anybody that comes into contact with the people that are infected or, anybody that, mainly with the direct contact of their bodily fluids, I mean, it can be anyone, it can be the mailman, or.
Correct. It just that if you're in contact with somebody and they have symptoms at the time, yes. If they are symptomatic with Ebola symptoms and you come in contact, then you're at risk, and you should be, you should talk to your family doctor, whatever, and those individuals that do make contact with an individual with Ebola. That's what they're doing with the people in Texas. There were 2 hospital workers that contracted Ebola from the patient that had it, and they're watching them. They watch them for 21 days. That's the period of time that Ebola is going to happen. That incubation period, like you said, from 3 days to 21 days, the symptoms can manifest. And like I said, with 90% fatality, this is something serious, for those people in Africa to contend with, to try to maintain this and to minimize the spread of this Ebola virus beyond the Africa itself, or West Africa. But what is talk about the animals? The diet of the West African people it's actually insects, it's rats, and it's monkeys. And this stuff they call bush meat is something that they prepare, their delicacy, and the people that prepare it, I think, would be at risk.
Yes. Coming
in contact with the blood and the fluid from these animals as they're slaughtered, as they're processed, I'm sure.
Yes.
And of course, we don't, it's forbidden to import any of this bush meat into the United States. It's watched very closely, and so that none is brought into the United States across our borders, so that we can feel reassured in that respect as well. And let's talk about people coming into the United States from, let's say, from West Africa, from these areas, these endemic areas where Ebola is manifesting right now. Let's say they're coming from Liberia, they're coming from Guinea or Syria. What do we do when they come into this country? They've been there.
The hospital, the airport, has protocols set up to where they screen passengers for fever. So anybody that's coming from the endemic area, once they have a fever, their protocol is to quarantine them. And there's a lot of controversy about that. Some people don't agree with it, but I think that's at least it's a screening process to minimize the spread. So.
What about people traveling to Africa? Should they be concerned if you're going to these areas? I know the CDC recommends that no one travel to these areas except healthcare workers that need to be there for supportive care that's sent there by the CDC or the World Health Organization. But and that's put out there as well as a travel advisory. But if you're traveling outside the country and you're not sure, where can they find information besides their family physician? Who do they go to for information on this?
Well, some people have to travel to the West Africa region for work, like those oil field worker and whatnot. But I think
we have a lot of oil field workers in Louisiana that do come from that part of the world. So
I think they can seek more information through the U.S. consulate. But it comes down to the basic thing. You wash your hands thoroughly with soap and water.
Just like the flu.
Yes, just like the flu. If there's no soap and water available, you use the alcohol-based sanitizer. Basically, those things, and make sure, you don't come into contact with the patient or the people that have symptoms of Ebola or even the dead bodies. Even though the patient or the people died, you shouldn't come into contact with them because the virus.
So the person who's embalming these bodies becomes at risk as well.
Yes.
To contract Ebola.
Yes.
And that's a serious thing. Let me ask this. We know that in Louisiana we have no cases. We do have people coming in, they're screened. Into the United States, they're screened at our borders. Put it in perspective, Virasith, regarding how really scary is this? How many people we have that die from influenza each year? How many people die from here in the United States? Let's put it in perspective from that standpoint. The 4,000 that have died from Ebola in West Africa. Not to minimize it, but let's put it in perspective here in this country where we're at.
Yeah, where we're at, we right now, in the media you hear about Ebola.
Is that a big number, 4,000? It's quite a bit, a lot of people to die from a disease,
It is, but you also, they don't also, you have to think about, or what they don't mention also is a common flu. It kills about 500,000 people a year in the United States. So, when you compare 4,000 to 500,000 is a big number. When you come talking about diseases from the Africa continent, malaria, it kills about 1 million people every year. So, the thing is, should be worried? Yes, we should, but should we be scared of it? I don't think we should. Mainly because, I think this year, because it's a huge endemic in that area, the media did, mention it a lot, but I don't think we should be scared, So.
You think we have a possibility of a cure? I know they're using some of the serum from those individuals who overcome Ebola, and they build up antibodies to the organism. I know the doctor and the hospital administrator from West Africa, that was from the United States, but in West Africa, helping on this with the CDC, contracted Ebola, although they took every precaution, with the special suits and washing them down after they come out of the treating the patients. In these suits as well to keep them from being contaminated with the Ebola virus. But your thoughts on, do you think we're moving in a direction of a possible, any kind of antidote for this? Any of our antivirals or retrovirals can touch this or kind of minimize some of this at this point in time?
At this point in time, no. The current, antiretroviral we have or antiviral we have, it's not effective for it. But I think we're moving in the right direction. The CDC is working really hard and collaborating with the government and the healthcare ministry and the other countries to try to come up with a vaccine. So for this. So I think we're headed in the right direction. But to find a vaccine for this is difficult, and going back, this has been around since 1976.
Right.
So, but at least, the research is being actively, done, but only time will tell, if we're gonna have a successful vaccine against this.
I really wonder, and I know it's a question and a point that's on the mind of many people, are hospitals prepared for this Ebola outbreak in the United States? How would that be? How would we be geared for this Ebola outbreak here? How are we prepared now? What's in place in our hospital systems? I'm thinking that it would be the same. We have the same protocol be applied to that as someone comes in with another type of infectious process. The gowning, the gloves, the very special care. The gowns that are put on to protect the individual going in to take care of the patient, your health care providers, and the mask for the splashing, any bodily fluids. Anything in addition, but the hospitals already have a protocol for infection, of course, but let's take it to the next level. For the Ebola virus itself, what would be, what's in place in the hospitals?
I don't think,
Or does there need to be something in place?
Yeah, I think, I don't think, first off is I don't think the hospitals, mainly the community hospitals, are not prepared to deal with this. Case in point is the hospital in Texas, the Texas Presbyterian Hospital. Mainly because, the hospital like in Emory or the one in New York, this type of virus, that you're trying to contain, quarantine and whatnot, you need like an isolation room, and isolation meaning that from all the other patient population. On top of that, you also need like lab work to be drawn there to where you can minimize, healthcare workers from going to different areas. So I think the Louisiana Office of Public Health already has a protocol in place that's been around that the ER will, if they suspect Ebola, they can quarantine them, and then usually they would send the patient to the hospital that's qualified. For instance, the one in Atlanta, or the one in Maryland, or the one in New York.
And you talk about lab work, I guess CBC, I guess they check, they're looking at, I guess, the kidney function, the
Yes.
creatinine BU, and also looking at liver function as well, because that's something that can go down as well in
Yes.
this
Mhm.
type of situation. And I guess they're looking at liver enzymes to see if there's any liver involvement at various stages. And then when somebody contracts it and they actually are given the supportive care and they're rallying and they're actually going to survive this thing,
Yes.
then they check them so many days or weeks after the virus, after they have cleared this hurdle, and they're getting better and they're recovering, that they can clear this virus and it's completely out of their system completely after they're over this bout.
Right, and to be exactly, they check something for the IgM and IgG antibodies. Initially, when you suspect that the patient may have it, you check for the IgM to the Ebola virus or the ELISA test, and then while monitoring for treatment, you start measuring the IgM level and IgG level. Usually IgM is an acute process. Those are indicating that the patient had an acute infection. And once you recover, the IgM level would be undetectable, but the IgG would still be there. But that's the antibodies that you develop to it.
They have a 1 hour urine screening test to diagnose Ebola within 1 hour in the hospitals. And then I guess the ELISA test, what you're talking about, if you're
Yes.
talking about the ELISA, is 24 to 48 hours to determine, to confirm, I guess that's a confirmatory test to
Yes,
confirm the
it is.
diagnosis of Ebola. Let's recap and let's give some high points on the topic of Ebola. Of course, if you join us late, this is It's Your Health. I'm Dr. Rick Duplantis. We're talking about Ebola. And that there, number one, no outbreaks in Louisiana. There's been no outbreaks in Louisiana of Ebola. That's reassuring for all of us in Louisiana. But go ahead and recap, this for us.
So, the signs and symptoms, basically I want to touch on first, fever, headache, nausea and vomiting, diarrhea. The travel history, to the West African nation, patient have to be come into contact with the bodily fluids of the infected person or the infected person or deceased. And the testing for it is the IgM antibodies, as well as the ELISA, the virus isolation as well. And for the recovery, they mainly monitor for IgG antibodies, and and those are the main thing. And treatment, there's no definitive treatment such as viral or vaccine, so it's all supportive care. And patient die mainly from complication from the DIC that you mentioned, hemorrhagic fever, you bleed out. Another thing is, that you mentioned also, with the organ and liver failure, the multi-organ failure.
Correct. Yeah.
When all the organs start shutting down and people die from that. So
Right.
supportive care really is the key, and it really depends on your immune system too when you're talking about supportive care. So if you have a strong immune system, your chances of making it, through this illness are very good. But if you have a poor immune system or compromised for whatever reason, then your prognosis become poor.
Very good point. Dr. Virasith, I want to thank you for your time, taking your time off from your busy schedule to appear on our show. It's Your Health, and I'm sure we've given the people a lot of information here on the serious topic of Ebola. We're not at risk as such, and there's no really need to be a panic for us, and things are in place to protect the United States from this Ebola virus this time.
And I'd like to also, thanks a lot for letting me come to your show.
It's a pleasure.
I think you're doing a great job, by informing the community about, this topic, you know, Ebola. I mean, it is so much misinformation and information out there. You don't know which source to go to, and it can, you know, make people panic, make the whole community panic. So I think you're doing a great job by
Well, thank you very much. I appreciate your help coming on in time to expose this myth beyond Ebola and what it's all about. Thank you very much for your time.